I want to end the training with some additional next steps that we have going. So I do want to mention that the team-based care dashboard that is in place right now is version 1. So we're calling this version 1 because we know that there are going to be tweaks and changes made to this, along with some additional reports that we're wanting to include. So in terms of next steps, we are providing access to all clinical staff on November 1st. So that is on Monday. This is the video presentation that is being recorded so that case holders have access to that. I will be placing this on the training tab of the intranet just for easy access. November 15th and 18th, we will be hosting 2 technical assistance lunch hours, and we're going to be scheduling those from 12 to 1. If you have any questions, that is the perfect place to come. Myself and Shanti are on the quality team that are going to be answering any questions that you might have and being able to provide some additional guidance. So please attend those. I will also be posting those Zoom links under the training tab with this training presentation. Ongoing, you can actually access technical assistance from us by emailing our quality@cmhcm.org distribution list. That will come to Shanti and myself just to make sure that if you have any questions or additional reports that you think might be helpful, that we will all get that. New reports are going to be prioritized by need, and we're going to be taking those to the supervisors group on a quarterly basis to prioritize those, because building these does take time. So we do want to make sure that the most important reports are prioritized first. In terms of reports currently being worked on, I do just want to mention this. We are currently working on these reports that are listed. So as I mentioned, those CIS and CAPAS level of care reports, we are looking at bringing in DLA 20 reporting to determine longitudinal changes over time for consumers. So for both an aggregate level for the team, as well as an individual view for consumers as well. We are looking at bringing all of those caseholder dashboard reports on compliance and document timeliness over to this dashboard. So I just want to mention, we are not getting rid of that dashboard right now. So you still have access to the caseholder dashboard along with the supervisor dashboard, because those reports have not been brought over yet. So those include reports like the consumer attendance report, consumers not seen in 30 days, sale timeliness, unsigned documents, authorization utilization reports, appointments with no documentation, and those Medicaid redetermination dates. So again, we are not getting rid of the caseholder dashboard, but we are looking in the future of bringing those over to the team-based care dashboard so everything is in one place. We're also looking at building a demographic snapshot for teams. So really, we want to be able to show the breakdown in population that you're serving, race, number of HAB support waiver cases, number of respite cases, homeless consumers, residential cases, just some additional demographic information so you can see the composition of your team. Also looking at building a nursing assessment report. So we want to be able to show the consumers who need a nursing assessment along with who has declined nursing assessments within the teams and by caseholder. We're also looking at length of stay for consumers in specific programs and evidence-based practices. So showing the total length of stay for consumers within programs, along with an aggregate of the total length of stay within our services. And we are also looking at bringing in for HAB support waiver consumers specifically, recertification due dates. So you're able to easily see those and be able to track those along with those due dates. So I'm going to call this version 2. We are currently working on this. We will notify everyone as soon as possible once we have these reports ready to go. I'm foreseeing this to be happening within the next couple of months, hopefully by the beginning of the new year, so January 1st. That is at least my goal. So hopefully we get that met. Overall, I just really want to just say thank you to everyone for everything you do. It truly is appreciated. And I do want to just give a special shout out to Kathy Todd for all of the guidance she's given on team-based care, helping us with this dashboard, along with our team-based care champions. They really looked at all of the data to try to make it as useful as possible, gave some additional just input into this along with what was going to be helpful for the team. So I do just want to say thank you to them. And I want to mention again, if you have any sort of feedback for us, please email us at thequality@cmhcm.org distribution list. We know that because this is a new process and a new just resource for you, that there is likely to be issues. I just want to mention that there is probably going to be access issues. So please just let us know by emailing that distribution list. If for some reason you can't access your team-based care dashboard or you're having issues accessing that, please just let us know and we will try to troubleshoot that as much as possible. Again, just a plug for those 2 technical assistance hours. Shanti and myself will be answering questions on November 15th and 18th between 12 and 1. Thank you again, and I hope you have a great day. If you have any questions for us, please email us.